Harris.
And I move the government amendment. I'd like to thank members for their contributions and indeed deputies for tabling this motion for the opportunity it provides to discuss the recent dispute between health service employers and the nursing unions, obviously the INMO and the Psychiatric Nurses Association. And following the recommendations issued by the Labour Court on Monday, the INMO and the PNA industrial action scheduled for 3 days of this week has been suspended. I know that's been very welcome news for patients right across the country, and indeed taking the point that other deputies made, welcome news for nurses and midwives who I know want to be back in their workplace and not on a picket line. Since this suspension was announced, I can assure you that the HSE immediately commenced work to address the cumulative impact this dispute had already caused and to try and get our health service back to a degree of normality. It is clear that the previous 3 days of industrial action, which involved a withdrawal of labour by nurses and midwives across the public service, had already had a significant impact. The further planned escalation, if it had proceeded, was likely to severely challenge the ability to provide a safe service to the public. On that basis, the government very much welcomes the decision by the nursing unions. I understand and accept the decision to take this action was not taken lightly by nurses and midwives who would rather be at work, and I agree on that point. This was an action not taken lightly. I would also like to take this opportunity to thank the members of SIP2 who did not engage in industrial action throughout this period. And it is important to point out we did have SIP2 nurses and midwives who didn't engage, and I think it's important when we talk about other unions that we acknowledge their decision as well and thank them for their ongoing services. The government has accepted, Ceann Comhairle, the recommendation of the Labour Court to resolve the industrial action with the nursing unions, and I think that's important. We had an independent recommendation given by the Labour Court, the highest industrial relations mechanism we have in the land, and the government at its meeting on Tuesday accepted that recommendation in full. The Labour Court intervened in this dispute due to the exceptional circumstances and indeed the grave and extensive implications of the dispute. I'd like to, on the record of this House, thank the Labour Court for its intensive work between the two parties, particularly over the weekend, and I'd like to thank my own officials, the HSE and indeed officials in the Department of Public Expenditure and Reform for the hard work they put into helping to arrive at a point where the Labour Court involvement and engagement proved fruitful for both sides in terms of a recommendation being produced. Whilst I'm very conscious in speaking here today that the recommendations remain to be accepted by the INMO, I would also like to thank their leadership for their continued engagement with the health service management throughout this dispute. I think that's very important. Even during this dispute, they were working to put in place contingency plans, and I thank their leadership in relation to that as well. As referred to in the constructive Fianna Fáil amendment to the motion today, an amendment which I welcome, the government agrees that all sides to the dispute should be given time to consider the recommendations without interference. It is important we allow the unions do what they do and have their own deliberative process and consult with their own members. I understand that the INMO is to consider the recommendations further at its executive meeting today, and the INMO will also consider its own ballot process. So the government does not intend to interfere with that process, and I'd suggest we shouldn't in this House either. It's a matter for nurses and midwives, members of the unions now, to give their views in relation to these matters. I should also note that talks are continuing with the PNA and that the Labour Court has invited the parties to a hearing on Friday of this week. However, the original motion as presented by People Before Profit Solidarity seems to set out a very simplistic approach to dealing with what I believe was a complex dispute. The recommendations issued on Monday by the Labour Court are grounded in the reality of what is achievable within the Public Service Pay Agreement. And I heard from most parties in this House, though not all groupings, that people wanted a solution to be found within the context of the Public Service Stability Agreement. And indeed, many of you put it up to government that it was possible to find a way forward within the context of that agreement. This was complex, but that was the work that was underway. The recommendations also met the three principles that this government had repeatedly stated it wanted to achieve in any solution to this dispute: a deal that is fair to taxpayers, fair to public servants as a whole, and fair to nurses and midwives. I welcome the recommendations as putting forward further realistic measures which should help improve staff retention and recruitment within the nursing and midwifery profession. It's also very important that the recommendation requiring staff to agree to improve productivity measures as part of an introduction of the enhanced nurse practice role. The recommendations include a range of changes and initiatives to deliver enhanced practice in nursing and midwifery. These include contract changes, agreements to flexibility and assessment of rosters in the context of the framework on safe staffing, a review of staffing and skill mix in all areas, including ambulatory and outpatient areas, full cooperation with the implementation of integrated care organisations in our health service, and full cooperation by all sides with the implementation of the healthcare assistant review. As part of the rollout of these measures, provision will be made for an enhanced nurse practice salary scale. Funding will be linked to savings from reduction on agency staff costing, using fundings from the new entrant salary scale agreement and savings from increased productivity. The Court also stated that these savings would need an independent verification mechanism under the auspices of the Court, and it even goes so far as to state that if savings are not realised, it will reconvene to examine this mechanism. The recommendation also proposes a new location allowance for nurses working in medical and surgical areas, and in the longer term it's also proposed that an expert review of the nursing profession is to be undertaken and to be completed by 2020. Another positive development is the commitment to the national rollout of the Safe Staffing and Skill Mix Framework. As Health Minister, I very much welcome this and welcome the acceptance of the recommendation by the Government. This will be implemented now by the end of 2021 at an accelerated pace as to what had previously been agreed. Additional advanced nurse practitioners are also to be recruited, and if we're serious about Sláinte care, and I am, we will need more advanced nurse practitioners, and the commitment under this recommendation to 700 across our health service will be a great help. In summary, this recommendation provides the foundation for significant and meaningful reform of the nursing and midwifery profession as we know it. The motion today has also raised a separate issue of union recognition in the context of a separate dispute. The union in question, the National Ambulance Service Representative Association, NASRA, is affiliated with the PNA. This group are to engage in industrial action over 3 days starting on Friday. This is a further escalation to an earlier one-day withdrawal of labour earlier this year. NASRA is a group which is currently not recognised by the HSE and therefore does not currently have negotiating rights for ambulance personnel. The PNA, which is a non-ICTU affiliated union, has negotiation rights for nurses working in psychiatry and intellectual disability sectors. SIPTU, Forsa and Unite represent the ambulance grades. It is regrettable that this industrial action is being taken, and I have asked that my department would engage with the HSE to explore ways forward to see if we can progress a resolution of this dispute. The proposers of the motion also put forward propositions describing the health service as being starved of resources, despite record funding being provided to the HSE in 2019. We have many challenges in our health service and many challenges in relation to reform of our health service and a lot of ongoing work. But the idea that you suggest it's starved of resources, I don't think bears up to much scrutiny. Clearly also, funding alone is not the answer. And I note the reference in the motion to providing an equitable health service. I believe that the vision set out in Sláinte care, which I don't believe your grouping has signed up to, I think you're the only grouping in the Oireachtas not to have, but I'm open to correction on that, will greatly assist us in achieving improved access to services based on a person's needs. I do believe now Sláinte care is the bedrock. It is about an equitable health service. It's about delivering a universal health service, and it's one which all major political parties and most independent members of this House have signed up to. To support the delivery of Sláinte care, the Government have put in place key structures to drive and implement reforms. These include a dedicated Sláinte care programme implementation office, led by an executive director, which is now established with an allocated budget for this year. The Sláinte care programme implementation office will publish action plans every year and progress reports twice a year. In the meantime, for the first time, the HSE based and developed its national service plan for this year on the framework of the Sláinte care implementation strategy. The focus on Sláinte care in this process is an important element of the strategic transformation of our health service. It is worth noting that the changes to the nursing profession contained in the Labour Court recommendations are transformative and are in line with the agenda of Sláinte care. And I think that's the encouraging thing when you are trying to resolve an industrial relations dispute. To find it being resolved in a manner that is compliant with our health reform policy, Sláinte care, I think is very encouraging. The cost of living is also something which the proposers of the motion have put forward. This Government has taken and will continue to take a number of measures to try and address issues in relation to the cost of living. By the end of 2019, this year, the Government will have spent €6.6 billion in the last 4 years to accelerate the delivery of housing supports. In my own department, over successive budgets, we've extended access to free GP care, we've reduced prescription charges, which will be reduced again at the end of next month, we've reduced the threshold of the drugs payment scheme, which will be reduced again at the end of next month. So to conclude, Ceann Comhairle, I would like to return to the Labour Court recommendations made on Monday in relation to the nurses' dispute. I firmly believe that these recommendations do present an opportunity to enhance the status and the significance of nursing and midwifery through collaboration and dialogue and through the implementation of Sláinte care. Of course, there's an awful lot of work to be done by all of the parties involved if the recommendation is accepted. A new nursing contract needs to be agreed. An agreed model of measurement and verification of savings, particularly from agency staffing, needs to be developed. And the expert review group on nursing, which many in this House called for, many people called it a commission, but effectively an expert review group on nursing will also need to be set up. However, the parties must now be given the time to consider the recommendation without the interference of government, and I would respectfully suggest the Oireachtas. I think it is important that we allow nurses and midwives the space to consider this recommendation to consider what it means to them, what it means to their colleagues, what it means to the workplace, and to give their adjudication in relation to that. As opposed to the proposals in the motion, this government takes a longer-term strategic view of the situation, and we are working to ensure that the role of our nurses and our midwives will be enhanced, strengthened and aligned with the future health needs of the population. And in relation to the other dispute, I do hope that engagement can happen to try and find a way forward to resolve it, because we do not need any more industrial relation disputes in our health service.